What's on offer here in Australia? We've got the Pfizer or we've got the Moderna vaccines. Is there a difference in efficacy as booster shots against the Omicron variant?
Look, I think the most important message we need to get across is it's a bit like what we've had with the other types of variants of vaccines we've had. You take whatever gets given to you. And in this particular case, especially with Moderna and Pfizer, really there is no difference. I'm about to get mine done in January and I'm not even going to ask. I just need to get a third booster dose. And that's just the important issue here at the moment. They're both extremely effective at increasing our level of immunity, if you like, against this particular virus.
All right. Well, now the government says that booster shots should be taken within 5 months. Is this within 5 months of after the second dose or after 2 weeks after the second dose?
So it's basically as soon as you've had your second dose, it has to be after 5 months after that time. So that's the important bit. And so it's quite okay if it's a little bit longer, but what they're saying is not before that 5 month mark. So as soon as you've had your dose, it's 5 months after that particular time, and just really encourage everyone to proactively start booking yourself in, because I'm sure there's going to be plenty of people who are going to be getting their third dose.
What I find intriguing too is that the government says the interval between the second dose and the booster shot should be 5 months, as we were saying, but there are some medical experts who are pushing for that to be a lot shorter, 4 months or so. Why the difference in opinion there, and what would a shorter period mean?
So basically we have a range of time. It's not necessarily 5 months in one day and it's all, horrible. We have a range of time that we can work within. So if you actually start bringing it in forward, then there's other issues associated with supply that we need to start thinking about. If it's too far out beyond the actual range, therefore the efficacy decreases. So what we try to do is bring it as the most effective time, and we're right within that range. But we also need to think about all the other issues in terms of supply and all these other bits and pieces of getting the community through. We know that there was such a huge uptake of vaccination. So what we want to also need to make sure we got the supply for the third dose. So these are the various issues that people are taking. Everyone doesn't need to worry too much about whether it's too short or too long. It's just it's 5 months, and that's a perfectly good time.
I'd like to ask you this question about testing before you travel. There's some confusion here. A lot of people are getting tested before they head to Queensland, because there is that rule you need to get tested 72 hours before departure. I wonder if you could clarify this for us. Is it 72 hours from getting the test or from getting the results that you can then fly?
Yeah, so basically it is from the actual test. So by the time when you actually get that result, you can travel within that 72 period of time. And it is a little tricky. I mean, I know when I went to Auckland, when we were allowed to do that, it was I was just thinking, actually, this is what the time is, and I'm about to check in, making sure that it actually all fits. So it's basically from when you're actually been getting your tested, self-tested, it needs to be within that time. Because if you think about it, if it was by the time you got the result, things can happen at that particular time. So it's ultimately from being tested. And I think the best thing to do is not really to make it at the 71 hour and 30-minute mark. Get yourself tested and then jump on the plane. And, once you get the cleared results that you can fly, get on with it and off you go.
There are a lot of nervous travellers right now at the moment. Now let's talk about these rising infection cases in New South Wales and in Victoria as well. Now we are being told that the Omicron variant is not as severe as the Delta. I think a lot of people are hoping that the Delta trauma doesn't come back again. What are your thoughts on this? Should we be looking at these rising infection numbers, or should we be looking at the hospitalisation rates instead?
So both of the numbers are important, and one leads into the other, to be fair. But probably the critical number is our hospitalisations. If we had a situation where we had rising numbers and everyone had such a mild disease and they're totally asymptomatic, and there were no changes in terms of severe disease, then that'd probably be okay. But we don't have that information yet, and that's probably also unlikely. So as I've heard Nancy say before, is that if we've got way more people with this particular virus, even though they might actually have less people with severe disease, it's still a lot of people. Yeah. So we need to just think about it and be, very take it extremely seriously. And really, the hospitalisation numbers, if they start increasing significantly, then you have to do something. And what we're asking it to do, of trying to people start putting your masks on and just being sensible, is probably a really good thing to do, because the last thing we want to do is go back into lockdown. But clearly, that have to be considered if you ended up with, in New South Wales at the height where they had 1,200 people in hospital. That's a lot of people in hospital with the one condition, and you've also displaced all these other people that normally would have had care.
Yeah. Just on the issue of being sensible, Bruce, it is the silly season. We want to socialise, and a lot of the infections are being transmitted through social circles, shall we say, the pubs, the clubs, the dance parties and whatnot. Christmas is around the corner. We are going to be socialising with family and friends yet again. What will be your advice in safely socialising, I suppose, during this festive season?
So it's a fabulous question. And when we say people just to be sensible, oh, yeah, right, we're sitting here in the middle of Christmas, come on. And, leave it to the public. It doesn't necessarily quite work that way. So clearly people are going to be out, but let's try and do some of the things that with the very low food, outside, way safer than being inside. Making sure you're using sanitizer as much as you possibly can. It's really, really important. Probably not going to a condition where you're just going to be absolutely jammed packed. Sort of thinking, well, do we really need to meet there? Can we meet somewhere else? Start putting on your masks again, even when you're traveling there. If you're going to be sitting in a space where there's lots of people, trying to limit all the things that we possibly can to allow us to be able to actually still socialise as what we want to do. So if I said don't do it, clearly no one's going to really listen in a hurry. But let's do everything else that we possibly can.